Microsclerotherapy looks easy, doesn't it? And yes, for some, with proper hands-on training and a step-by-step approach to injecting leg spider veins, microsclerotherapy is relatively straightforward. But there's more to treating leg spider veins than simply injecting them. I'm going to cover 7 simple steps to ensure that the treatment of leg spider veins by microsclerotherapy is easy, safe, and effective. So let's dive in, and towards the end I will share with you the most common side effect after microsclerotherapy for leg spider vein removal and what you can do about it. Step 1 is patient selection. Before you even pick up a needle and syringe, a thorough patient assessment is crucial. Assess the patient's medical history, allergies, any contraindications that might be present. Examine the patient both lying down and standing up, and perform any investigations that you think are required, such as a handheld Doppler or a venous duplex ultrasound scan. Explain the procedure in detail, its benefits and potential risks to the patient, and obtain informed consent in writing. Select your patients well, and you'll be well on the way to getting great results. If you select the wrong patient, it doesn't matter how good an injector you are, you won't get great results. Step 2 is vein identification. Carefully check the spider veins that your patient wants treated. That's what they've come for, and make sure they have those veins treated. Use good lighting and magnification as a routine. You can't inject spider veins accurately if you can't see them properly. Step 3. Identify feeder veins, also called reticular veins, and I find a transillumination device such as a vein light to be very helpful in this respect. Having identified any reticular veins near your spider veins, make sure that you're going to treat those first. Make sure you inject the spider veins and the associated reticular veins as part of your microsclerotherapy treatment process. Step 4. Injection technique. Accurate injection is vital. These veins are tiny. Stretch the skin and insert the fine gauge needle into the vein using a gentle, controlled motion. Ensure you're entering the vein at the proper angle. Slowly inject a small amount of microsclerotherapy sclerosant solution, looking for blebs and taking care not to overfill the vein. Stop immediately if your patient experiences any pain. A useful mnemonic is low, slow, low. Low volumes of sclerosant, slow injection, and low concentrations of sclerosant. Step 5. Needle removal and compression. Once the injection is complete in that particular area, withdraw the needle slowly and apply gentle pressure with a sterile gauze. This helps prevent leakage of the solution into surrounding tissues, and it promotes optimal vein closure. You might also want to massage the treated area and disperse the sclerosant solution evenly within the vein. Step 6. Post-injection care. Make sure that your patient understands what will happen after the treatment session, and here it's very helpful to give your patient written information to take away which will reinforce what is likely to happen, what your patient should look for, and what they can expect during the healing process, and give them contact details of how and when to contact you should they have any concerns. Finally, step 7. Arrange follow-up and complete the documentation, and I think you should do this before the patient leaves, and also arrange a follow-up appointment with your patient. You can then check on their progress and address any concerns. Also, before your patient leaves, document the procedure details carefully. Which areas of the leg you treated, what sclerosant you used, what the strength was, the expiry date, the batch number, and document any reactions that your patient may have had. Did they find it particularly painful? Were there any blebs during the procedure? Accurate documentation is very important for medical, legal, reasons, and also to help you assess their progress at subsequent follow-up. And there you have it. Microsclerotherapy made simple in 7 steps. Remember that patient selection, constant practice, precise, accurate injections, and good patient care are paramount in mastering the whole process of microsclerotherapy for leg spider veins. At the beginning of this video, I told you I was going to share with you what I think is the most common side effect patients have after microsclerotherapy and what you can do about it. Well, in my experience, it's that patients are often surprised and sometimes even alarmed when they look at their legs a week or 2 afterwards and they see that they actually look worse. Even after a careful explanation of the process at the initial consultation, many people after microsclerotherapy are alarmed at the appearance of their legs. Now, these injections are not going to get rid of leg spider veins immediately. Microsclerotherapy is not a quick fix for leg spider veins. It's a process. 2 or 3 injection sessions may be required with a gap of 6 to 12 weeks. To anticipate this side effect of microsclerotherapy, be sure to emphasize at your initial consultation that for up to a month after the injection session, their spider veins may look worse. Considerably worse, actually. And this is important for 2 reasons. Firstly, it will help manage your patient's expectations. And the other reason is that your patient may wish to defer treatment because they have an important upcoming social event or they're about to go on holiday. I find it really helpful to see my patients about 2 weeks after their microsclerotherapy session as a routine. I can then reassure them that the appearance of their spider veins at this stage of the healing process is normal, and if there's any clot formed within the vessel, I can then release it at this stage, a process called microthrombectomy, and this will reduce the risks of pigmentation after the treatment. Microthrombectomy involves pricking any excessive clot formation with a needle, releasing it. Now, in the description box below, there's a link to my free mini course, How to Inject Leg Spider Veins and Blue Veins by Microsclerotherapy, where you'll find more tips for successful injections. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel. And check out all the links in the description box below. Why not leave me a comment or a question? I really look forward to reading all of these, and I promise that I'll get back to you as soon as I can. I hope to see you again soon, so don't forget to hit the subscribe button, and that way you won't miss my next video.